You give me hope, the strength, the will to give on.
Hello everyone, this is Chef Michaela of Seafood Galore.
This is Mervic Vicky Monosilio, and I would like to invite you tomorrow. That's the
and I'm inviting you all to watch JhermiNATION Help Our.
So on behalf of One You Connect, we would like to thank One Nation.
Hi everyone, I am CJ Little. I am your creative
Karandang, yung Mrs. Tabocin UK 29.
Hi everyone, I'm Irene Coloso, and I would like to...
Ako po si Christine. Gusto ko lang po kayong i-invite sa interview.
Instructor and founder and co-creator of
Curator. I'm inviting everyone to join me.
And I'm inviting you this coming February 24.
I'm an actor, singer, and entertainer.
I'm currently the Director of Skilled Healthcare International.
I am a newly arrived nurse here in the UK.
Space Organization Coach, and I would like to invite you to join.
Hello everyone, good morning and good evening to everyone.
Everyone, my name is Victoria. I'm a UK-based transgender actor.
Of Artist Venue UK, please join us on...
Watch me tomorrow, June 9, at JhermiNATION Facebook page.
UK time, and we're going to be talking about how I manage.
Join me on JhermiNATION show this coming 2nd of June 2021, hosted by...
And I'll be joining the live stream of Germany.
7 p.m. UK time. I'll invite
the JhermiNATION show happening on May 12, 7 p.m. Philippine time.
Check me out on the JhermiNATION show from the UK this Sunday, May 2nd.
On Sunday, April the 18th, 7 o'clock London.
The founder of KEYWORKER Music and Arts.
28th of March, I can share my patient.
Expecting to you all watch us this Wednesday, 24.
Imagine what would you tell your 12-year-old self? If you're in front of your 12-year-old self, what? Good evening, everyone! Everything has its season, everything has its time. Show me a reason and I'll soon show you a rhyme. Cats feet on the windowsill, children fit in the snow. But why do I feel I don't fit in anywhere I go? Rivers belong where they can ramble. Eagles belong where they can fly. I've got to be where my spirit can run free. Gonna find my corner of the sky. Every man has his daydreams, every man has his goal. People like the way dreams have of sticking to the soul. Thunder clouds have the lightning, nightingales have the song. And don't you see, I want my life to be something more than long. Rivers belong where they can ramble. Eagles belong where they can fly. I've got to be where my spirit can run free. Gonna find my corner of the sky. Yes, hello. Good evening, ladies and gentlemen. Good morning, good afternoon, good evening, wherever you're watching from right now. And welcome here in JhermiNATION PB, our hub for health, arts, and business. And I'm your host, Jeremy, here in London. And I take it that you're all doing well and keeping safe wherever you're watching from right now. So please write on the comment box where you're watching from so I can give you a shout out. And we are live streaming simultaneously on our YouTube channel and on our Facebook page, JhermiNATION. So welcome to all those who are watching there like right now. And of course, we are live on Filipino Nurses Association UK Facebook page. Hello, welcome everyone. To all those who are watching there at FNA UK Facebook page. And we're also live on One Nation Awards UK Facebook group. Welcome everyone. We're also live on Discovery. We're also live on JhermiNATION Got Champion Facebook group. Ayan. And of course, thumbs up and hearts will be very much appreciated. So don't be shy. Give it a try. Click those buttons now. And I would like to welcome all those who are joining us right now. We have Arlene Bautista. Welcome here. Thank you for watching. We have Mark Antonio Pangan. We have Mini Pascual Clepas. And welcome here. And let's just see. We got some comments here. Welcome, everyone. And of course, if you are new to JhermiNATION, please don't forget to subscribe on our YouTube channel and give our Facebook page a follow and a like. And of course, JhermiNATION wouldn't be complete without the seed that we can plant into your mind and let it germinate. Because here in JhermiNATION, we believe that everything starts from within. So our inner works for today is this one.
Welcome to Inner Works, where everything starts from within. For this week, let's start off the day by creating a safe space where we can speak our truth and live our authentic lives. For this week, I'd like to share to you guys all about social battery. What does it mean? Have you heard about it? Well, according to Urban Dictionary, it is a metaphor for our capacity to intermingle in certain social groups, or in short, basically, it only means that it is our supply of energy in socializing. So, okay, very interesting, isn't it, guys? So, let us discuss what drains our social batteries. I have 5 points that I'd like us, like common situations that we encounter in life. Number 1, friends only taking, not giving. Okay, so in any relationship, it should always be give and take because there's always a balance to it. So if you give, you should be able to receive as well. Number 2, toxic and harmful gossips. Okay, it's not always good to take part in negativity, isn't it? So that is just plain and simple. If it's something negative, I think we should try to avoid those kinds of talks because it doesn't really let our souls enrich, or it doesn't really enrich us our souls. Number 3, excessive emotional dumping by others. Okay, this is a little bit controversial because this always happens if we wanted to listen and be there to support our loved ones, may it be our partner, mother, family, friends, colleagues. But sometimes, guys, remember, if you already feel vulnerable, be careful of other people dumping their negative emotions to you because that would drain you more. So number 4, people hurting our feelings. Hearing uncomfortable criticism or unconstructive criticism will always pull us down. Number 5, and this is the best one. Me, myself, I always get entrapped with this. And, you know, we could always try. Pretending to be somebody else. Alright, you know, sometimes social situations, you know, puts us in a certain situation where we have to pretend to be somebody. So recently, I've been trying to live my truth and be as truthful and honest as I can be, and it really helps me a lot. And as part of, you know, social battery and how it drains us, I think there's no sadder thing than to live a life that is pretentious. Don't you think so? So these are the 5 points that I think, you know, we should, you know, pay a little bit more attention to. And remember, guys, awareness is always the key. So we talked about that, and then next time, let's discuss on how we can recharge with this social battery draining. Okay? So for now, I hope you find that helpful. So please like and share, and comments are always available. This is your Mimi Mili, sending my love and light to you. See you next week, guys!
Sorry, I'm muted. Yeah, thank you, Mimi Mili, for that inner works, social battery. So beware of energy vampires. Okay, so I would like to bring in our special guest for tonight. But before I bring him in, let me just play this video invite that he prepared for us a few days ago.
Hello guys, my name is Mark Dalauidao and I am an infection prevention and control matron at King's College Hospital. I just wanted to invite all of you this coming Wednesday, the 30th of March at 7:30 in the evening at JhermiNATION Live. We're going to talk about infection control, what's going on around us, and what are the updates. And of course, we're going to have loads of fun. See you there!
All right. Are you ready for our very special guest for tonight? All right, let's bring him in. Ladies and gentlemen, let's all welcome Michael Mark Dalauidao, modern matron for infection prevention and control in King's College, and he is also the regional director of Filipino Nurses Association UK London branch, right? And he's also our awardee for KEYWORKER of the Year in One Nation Awards UK Breakthrough 2021. Welcome here, Mark.
Yes, good evening everyone, and thank you, Jeremy, for inviting me to be one of your special guests for tonight. And yeah, I just can't wait, you know, I just can't wait. I don't know what are you gonna ask me, but then again, I'm just so excited at the same time, anxious because, you know, anyway, for sure we're gonna have a lot of fun things to do, and hopefully at the end of this live streaming, I'll be able to to guide you, and especially for those who are newly arrived here in the UK, guide you with your career development, and at the same time motivate you, inspire you to be who you want it to be.
Yes, amazing. Thank you, thank you. And where do you live here in the UK, Mark?
At the moment, even though my work is in London, I'm living at Maidstone, somewhere in Kent, south of England.
And in the Philippines. So let's just give a shout out to all those who are watching there right now. Is it a Maidstone?
Maidstone, yeah, Maidstone,
Maidstone in Kent. Yeah. Shout out to all those who are watching there in Kent, and of course those who are watching there in London in King's College. And how about in the Philippines? Where do you come from, Mark?
Back home, I grew up in Isabela, northern part of Luzon, and then from college, I stayed in Manila.
I see. Okay. So Isabela, is that Ilocano or something
Oh,
or?
there's loads of dialects there, Jeremy. One is
I see.
Ilocano.
Uh-huh.
It's mixed really. Some are speaking in Ilocano, Ibanag, Gadang, Itawis. There's loads of different dialects there. But unfortunately, I can only speak two, the Gadang and the Ilocano. I think understand some of the other dialects, but I'm not able to speak them.
Ayan. Yes, let's greet all those who greet them in Ilocano for all those who are watching, all the Ilocano friends out there. Naimbag na Rabiio,
Yeah,
tama ba?
yes. Naimbag nga rabi iyo amin dyan ita sa Isabela. Hopefully nanonood kayo and yeah, welcome.
Yes, thank you, thank you. Wow, and let's just welcome all those who are watching right now. We have Matthew McDonald, welcome here. Emilia Dalauidao, welcome.
Oh,
We have Rodel
that's my
Saicon.
mom. That's my mom.
Oh, hello, mommy. Emilia Dalauidao, welcome here. And Rodel Saicon of COVID Warriors Corner, welcome here. Roy Galit, ayan, welcome. We have some, let's see, I think we got some comments in here. Ayan, a Facebook user, there's no name, but supporting our own Michael Mark Dalauidao. Ayan, thank you. Go Mark. I'm not sure, sometimes the name doesn't appear, but thank you for commenting. Watching from London Red Bus. Thank you, Rodel. Ayan. Are you doing your taralets tonight? I'm so proud of you, son. I love you. Wow. Thank you for commenting, Mommy Emilia. Ayan. Daddy, so proud of you, son. Dad always here for you. From Emilia Dalauidao. Arlene Bautista. Ayan. Whoop! When bakit? Oh, that is Arlene Bautista. Go, Mark. Ayan. Thank you very much. Mom Arlene. Thank you. And Sigs Balks, watching from UHCW University Hospitals, Coventry and Warwickshire. Wow! Thank you. Shout out to all those who are watching in Coventry and Warwickshire. Ayan, we also have Ate Daisy, our reigning Mrs. Pearl Philippines Eurasia 2021 in Queen of Charity. Thank you. Ayan, good evening. Ayan, okay. Wow, amazing. And Mark, I always do this to my special guests, and nobody escapes my quick fire questions. Did you see that coming?
No, actually, I think my mistake. I didn't watch the previous ones. I mean, I think there's like 3 of them that I managed to join. However, I didn't manage to start it.
Yeah.
Let's get it on. Yeah. But before that, I just wanted to say hi to my wife as well and my mother-in-law. I think they're also watching. I'm not sure if it's in YouTube or on Facebook. And my daughter Michaela. Yeah.
Wow. Welcome. Thank you for tuning in. Yeah. Okay. So quick fire questions. So basically, I'm going to throw you questions and you're going to answer it with the first thing that will come into your mind. So it's just a way of knowing you more, warming you up, and of course, having fun here in JhermiNATION. Are you ready?
I'm ready.
All right. Quick fire questions. Sleep or eat?
Eat. Definitely eat.
Eat. What was the last thing that you Googled?
COVID-19.
COVID-19.
Update.
Update. Yeah. Mark, apart from your face, which body part you look most in the mirror?
My hair.
Okay. What is your guilty pleasure?
Chocolate.
Chocolates. Would you rather win the lottery or live twice as longer?
Live twice as longer. I don't play lottery.
Okay, amazing. Would you rather have an X-ray vision or a magnified hearing?
A magnified hearing, I think, is safer. I don't want to see everything.
Dream or career?
Dream or career, did you say?
Dream or career, yeah.
Yeah, dream.
Dream. Security or opportunity?
Security.
Make money or save money?
Make and save money.
brain Brain or heart?
Oh, heart, definitely heart.
Heart, yeah. Rewind or pause button?
Pause.
Pause button. Wow. Mark, if you have the attention of the whole world right now for 10 seconds, what would you like to say?
I just wanted to take that opportunity to encourage and invite everybody to pray. I just wanted to take this opportunity to thank God for everything that, for the last 3 years. We've been through a lot during the pandemic, and we've lost someone we know close to our heart. And, I just wanted to invite them to pray, really, Jeremy.
Wow, amazing. Thank you. Thank you very much.
I passed it then.
All right. I hope you enjoyed that one, Mark. All right.
Oh,
So
I did. I did.
all right. So what treat are we in for today? So what value can we give our audience, and what can we learn from our live stream for today? And I always believe that we learn from each other's experience, and I always look forward to doing germination because I always learn from my special guests. So, and first, if you are a newly arrived nurse here, or you're still in the Philippines, you're a nurse planning to go abroad here in UK, US, or anywhere in the world, or you are here, in the UK, and you're just lost and you just don't know what's happening in your career. If you want some inspiration, this is the place to be. Share the live stream because we have Michael Mark Dalauidao here, who is a modern matron of infection control and prevention at one of the biggest trusts in London. Yeah, amazing. So, Mark, is nursing actually your first choice?
Uh, no.
What
Actually,
was your first choice then?
when I graduated in high school, I was I was thinking of taking computer engineering. However, I didn't manage to pass the entrance exam in Mapu. Is it Mapua? Is it I forget what's the name of the university now. I think it's Mapua in Manila, in Intramuros. And then one time my friends back in high school went to Far Eastern University. They did their registration and all, and I just asked them to, can you register me, get me some registration form and register me. So when I went to FEU, I received the entrance exam schedule. So I went there, and I didn't even realize that the one that they've applied me for is nursing.
Okay.
Because they're all taking nursing that time, so it was
Yeah.
nursing. So anyway, to cut the story short, I took the exam. I passed the exam in Far Eastern University in FEU back home. We have battery exams, and I don't know what happened, but then again, suddenly I had a change of heart. I enjoyed and loved nursing since then.
Wow, amazing. Did you come from a family of healthcare professionals?
Oh, not really. I think I'm the first one. I have an uncle, but he's a vet. But I don't think we are
The
everywhere
family of
actually. But yeah,
all sorts. Oh, wow, amazing. So you came to love nursing.
yeah.
and
Surprisingly, yeah.
yeah, and why UK? Why UK? Did you work somewhere else before coming to UK, like in the Middle East, or is this your first uh, time to work abroad?
Oh, you might find this funny, Jeremy. Back home, I was a national reviewer, board exam,
Oh,
licensure
wow.
exam.
Okay.
I was a
Wow.
freelance, I think, but most of
Mm.
my schedules is with one of the nursing, not nursing home, review centers.
Yeah.
Review centers back home. So I traveled a lot. I go to different parts of the Philippines for free,
Mm.
which is really good.
Mm.
Most of my colleagues that time they're taking their masters in UP, in UST, in FEU, and all that. And
Yeah.
then I said I will try to go to United Kingdom and do some study, probably a master's
Mm.
or a top up degree,
Oh.
and so I did. So that is my pathway. That was my pathway going to UK. I wasn't recruited by an agency from NHS.
Ah.
No. So my pathway. I was a student here.
Ah. Okay. I
I
see. I
yeah.
see.
So I applied. I think 2010 when I arrived here. It was
Mm-mm.
2010. I finished my BSc in International Healthcare and Nursing in
Ah, okay.
2013. Yeah, so
Mm-mm.
it was a honors degree, and fortunately, I managed to complete that, finish all my dissertation, and all that. Yeah, so that's how I came to the UK, and then after that, I said I'm gonna go back to home, and then I'm gonna have this credential. I finished this honors degree back in the United Kingdom because
Yeah,
back
yeah,
home, if you graduated somewhere else, not
yeah, yeah,
primarily UK, it is something. It is
yeah.
something,
That's true.
yeah.
Yeah.
But then again, I said if I'm gonna try to take the IELTS exam because it was a requirement to register in NMC. If I'm
Mm-mm.
gonna pass this exam, then definitely that's a sign that I'm gonna stay here. And
Ah,
I took the exam and I passed. I registered in NMC, and then everything went smoothly. And then yes, the rest is history. I'm still here up to now. And then I started working in NHS just in 2016.
okay. Wow, amazing, amazing story. Yeah. Quite different from all of us, you know. So talking about working abroad, you know, a lot of Filipinos leaving the Philippines and seeking greener pastures, you know, going to the UK, US, Middle East, you know, name it, you know. And as what I've said, most people come here for similar reasons, like
Yeah,
financial, economic, you know, better job opportunities, because
yeah,
let's face it, there's not much happening in the Philippines during the time. I don't know about now, you know, but I'm sure it's pretty much the same, because there's still a lot of Filipinos coming over here, you know,
yeah,
which is a shame, because we train there, you know, we have our loved ones in there, but yet we are coming in here, you know, looking after, foreign patients rather than our own fellow men like Filipinos, you know. So I mean, it's a chronic, you know, it's a chronic situation. I came here back in '99, and it's the same, still the same situation. Still a lot of nurses coming in here, which is good. But of course, and everything, there's always a pros and cons. So on the point of view of Filipino nurses coming over abroad, you know, what do you think we should improve, so just to at least decrease the number or reduce the number of Filipinos leaving the country to go abroad? What do you think we should improve in the Philippines?
Um, that's a good question, Jeremy. When it comes to the standard of care that we provide back home,
Mm.
definitely I don't have question. I think
Mm.
our nurses back home, or even the nurses around the world, Filipino nurses around the world,
Mm.
we are known to have that knowledge and skills. Yeah, but I think it's the system, it's the healthcare system that's really putting us down back home, because at
Mm.
the moment there's not much hospital that can accommodate all the nursing graduates. When I graduated in 2006, Jeremy, I
Yeah.
think that's the first batch of the boom of nurses, where I think on our batch we are all 60,000 who took the exam,
Yeah.
and there's only
Wow.
like
Yeah.
21.
Massive.
And there's only like 21,000 who passed. So most of my colleagues now, they're working in call centers, which is
Mm.
I think that's the go-to of all the nursing
Yeah. Yeah.
graduates, licensed
Mm.
nurses at the moment. But going back to your question, I think one thing that the government should focus is to improve the healthcare facilities, build more
Mm.
hospitals, especially in the far-flung areas
Mm.
where there's inequality in healthcare there for sure, and everybody would agree, especially in the provinces where access to healthcare is very hard, especially in the mountain provinces, or
Mm.
you have to travel many rivers, cross many rivers before you can reach the hospitals. But I think that is something, hopefully the new president or the new administration will focus healthcare. I think I've heard some of their platforms really focusing on healthcare, which is good, and hopefully
Mm.
it will materialize and it's not just talk, 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 talk.
I know. Yeah. That's
Yeah,
quite true. You know.
there's still hope. There's still hope. I believe
Exactly,
so, yeah.
exactly. And when I left the Philippines, you know, I don't know during your time, because we got like a gap, you know. I think we have 10 years gap when when you when we graduated nursing and coming over here. During my time, we have like we need to volunteer in a hospital. in order to get a position there? Is it still the same when you left, or
Yes,
you
yes,
have to be a
definitely.
volunteer?
Yeah.
Wow.
We have to volunteer. But the good thing about my time, we don't have to pay because afterwards, probably after a few years after I
Hmm.
graduated,
Yeah.
uh, they will still volunteer, but they have to pay the hospitals now for them to volunteer, something like that.
Oh, okay.
So,
They have to pay. You have
yeah,
to pay. They have to
yeah.
pay.
If I volunteer, I have to pay the hospital for giving me
Ah,
a like 6 months or 1 year to volunteer in that hospital. So
I think
I don't
I think
know.
it was pretty much the same. I think it's pretty much the same because I've been to a couple of hospitals before I came to the UK. It's the same. I actually have to pay the hospital in
Oh,
order for me
really?
to. Yeah, yeah. It's the same. I
Ah,
have to pay. Like to be absorbed. I mean, to be trained. To have that experience a few months. And to think that we are volunteering ourselves, but then we have to pay. So, I mean, what
okay.
kind of system is that, isn't it?
Exactly. That's the same question I wanted to ask. But fortunately, during my volunteer days, I don't
Yeah.
have to pay. Maybe because my dad knows someone in the hospital. That's why they didn't ask me to pay.
Oh,
Actually, I
that's
even
good.
I even brought my girlfriend then, my wife now, to volunteer with
Mm.
me back home in the province, even she's from Manila. Yeah. So
All right, amazing, amazing. So, what was the three main challenges that you were faced when you came here in the UK? What are the three main challenges?
three main challenges.
Yeah, when you came over here in the UK.
Of course, everybody experienced this homesickness. It's really true, you know.
Mm-mm-mm.
The first time I arrived here, August 20, no, not 2010, August 2020, 2010, and
Mm.
that time for me it's cold already, even though it's not winter yet.
Yeah.
Yeah, and it's just the change of the climate, and it's just the
Mm-mm.
change of the food that I'm eating. It's just so difficult to adjust really.
Mm-mm.
And also the language, of course.
Yeah, yeah.
I can speak English, but the accent is like different,
I know.
like I for sure I'm gonna be able to understand them, but then again, when I arrived here, I was like, yes. Even though I didn't understand a thing, I said yes, yeah.
Just say yes and
And
smile.
yeah, and then when you and then when it's gone, it's like, what did he say? I didn't even understand. Yeah. Also, some of the jargons they have here, like different from the American one, like
Exactly. Yeah.
the pants is the pants here
Yeah.
is the trousers back home, isn't it?
Yeah.
So
Yeah.
there's loads, the elevator, lift, these
Lift.
things.
Yeah. I
It's
know. There's
just
plenty.
so yeah.
Like OBS.
But
OBS. Oh, the blood pressure and the temperature. Oh,
yeah.
vital signs.
Yeah, back home it's vital
Vital
signs, but
signs.
here it's observations. And what's observations?
Yeah, yeah.
Yeah, so there's lots of medical jargons as well. Like it's
Hmm.
very different back home, but eventually, yeah, I managed to surpass that with the help, of course, of the first, I mean, Filipinos who
Hmm.
came before me. Then I
Yeah.
think, yeah, it really helped if you connect with your co-Filipinos here, and most of the Filipinos here are really really nice, and they're very helpful as well. And that oh, actually, I just wanted to share, Jeremy, when I
Hmm.
arrived here, I told you I was a student.
Yeah, yeah.
Our placement was in a nursing home. So
Oh, okay.
my university is up north, Northampton University, and my placement
Ah.
is in the southwest, in Somerset.
Oh, okay.
And most of the healthcare assistants in that care home, uh, Filipinos. Food wise, I still had difficulty adjusting, but then again, if they invite me, I would always say yes, and they know
Yeah.
that because they cook Filipino food at that time. Yeah, so yeah, so I think basically those are the challenges, I think,
Yeah, yeah.
and of course transitioning to nursing from a student
Oh,
here
yeah.
to
Yeah, yeah.
nursing as well. That's different because
I
I
see it.
used to be a before I joined NHS, as I've mentioned earlier, I just joined NHS 2016. But
Hmm.
from
Okay.
2014, I was an agency because that was the the one who gave me my visa, my work permit.
Yeah.
So they just send me anywhere. The good thing about that agency was it's 3 monthly. So I have to be in a post in a specific hospital for 3 months. But then again, the good thing about the ward that they put me is at King's as well. And the manager really liked me, and he always requests me every 3 months. After 3 months, I want Mark here. I want Mark here. And then I
That's
stayed
good.
there for almost 2 years before he encouraged me
Wow.
to join NHS. Yeah.
I see. Amazing, amazing. Wow.
I have to pretend that I have to pretend that I know everything and I know a lot of things about stroke, but in reality I don't know nothing about stroke because I was an agency nurse. The
Uh-huh.
expectation is I have experience, but yeah, those were the
I
days.
see, I see.
But
Wow.
I've learned, and I'm here now.
You got through, yeah.
I'm still here. Yeah.
Amazing. At this point, I would just like to welcome all those who are joining us. Michelle Ann De Vera Dalauidao.
Oh, my wife. That's my beautiful wife. Yeah.
Hello, Michelle. Welcome here. Thank you, thank you. And we have La Vida Greta. Yeah. Arnold Pedregal. Kuya Arnold of GFN channel. Ayan. And we have Miriam Insyong De Vera. Welcome here.
That's my
We have
mom-in-law. Yeah.
all right. Okay. We have Lady Mercury Rainer Inciso. Welcome here. And let's just get some comments in here. I have Manuel Sixto Agra Villador Dalawida watching from New Zealand. Daddy always have your back. Wow, thank you very much. Watching from New Zealand. Thank you. Shout out to all those who are watching in New Zealand right now. Yan. And Ate Daisy said, amazing two guwapings of the night. Wow, thank you naman. Thank you, thank you.
Salamat po. Thank you.
And then we have proud of you, Daddy. I love you. Yeah, that's Michelle Ann De Vera Dalawidao. Thank you. And we have Lady Mercury. Good evening, bro Jeremy. Lady Mercury watching from Bolton, Manchester. Yes.
Welcome.
Shout out to all those who are watching in Manchester, and of course to Lady Mercury. Wow, I'm excited to meet you guys this Saturday in COVID Warriors anniversary. Yan. And Miriam Insyong De Vera watching. Thank you. God bless you, Mark. Thank you. And then we have our inner works. Mimi Mili, I graduated from FEU as well. Oh, yeah. Okay. The Tamaraos. FEU
Tamaraos, yeah.
All right. Thank you. We are so proud of you, Mark. And we have Sigs Bulks. Ako napadaan lang sa agency. So happen UK ang hiring daw. Kakadating lang from Saudi noon. Okay. Wow. Thank you for sharing, Sigs. Very adaptive ang Pinoy. That's true. That's true. Yeah. And then sense of humor is the most difficult.
I would agree to that one, Jeremy. Up to now. up to now, I get difficulty.
Up to now, you can't. Iba yung humor ng Pinoy tsaka humor ng mga Brito.
Everybody's laughing and said, what's going on?
What's going on? Yeah. It's a dry humor, isn't it? We have Marvic Villanueva. Wow, watching from the Philippines. It's about 3 o'clock in the morning. Wow.
Exactly,
thank you, Marvic. Yeah. Thank you. Good evening. And good morning there, Marvic. Villanueva, daan lang po to share your show. Wow, thank you naman, Marvic. Thank you. Wow. So, Mark, how did you end up in infection control? Just out of interest. Why infection control? There's a lot of its specialty, So
this is a funny thing again, Jeremy. As I've said, I've started as a stroke nurse.
Okay.
January 2016 when I joined NHS. Mm-hmm. After 9 months, still stroke, but I was promoted to band 6 and became a thrombolysis nurse at that point. And then, I stayed there for almost, I think, 15 months or 16 months before I joined infection control. With infection control, there's one shift, night shift in stroke unit. Just got bored and then looking through, opportunities. And I saw infection control. I just
sounds
applied.
Fancy.
Yeah.
Why not? Sounds fancy.
I was active in vascular access. I was a link for vascular access or IV. And then so I said it's somehow related, infection control. Okay, might as well apply. So I did apply. I think I didn't even manage to to tweak my statement. That was my statement when I applied for the band 6. And just by the grace of God, fortunately, they shortlisted me, and then they offered me the job. And yeah, that's it. And then from then, my manager is so supportive. They supported me to finish my masters, which I've just finished recently. And now, yeah, I've got this post now as the band 8A at King's College Hospital infection control team.
Wow, amazing. I used to be a stroke nurse as well, thrombolysis and all these things. So
from St. Thomas, yeah.
Queen's Hospital in Rome.
Oh, Queen's Hospital. Okay.
Yeah. I was a stroke CNS there for 3 years. Thrombolysis, doing thrombolysis.
I thought I'm gonna end up with a stroke as my specialization. I have my matron got a plan for me already, until just one day I said, okay.
You got infected with infection control.
Yes, definitely, yeah.
Very
That's what
infectious.
happened. Yeah, it's just interesting. Infection control. It might not be a cup of tea of everybody, but I find it fascinating every day. There's no two same day. I mean, every day there's loads of things happening, and different every day. Every day.
Wow. Especially you're in you're the matron for the whole hospital, right? So you're like responsible
very
for the
challenging.
prevention and control of infection. Wow. All
Yeah,
these C. all these things, MRSA, and not to mention COVID, of course. So what was the most challenging, 2020 outbreak, pandemic, everything. So that must be very, very challenging. So what can you remember during that time that you would like to share to us?
As an infection control specialist, yeah?
Which is really most challenging for you? I'm sure
As
it's
an-
very challenging because,
Oh, definitely. As an infection control, yeah?
Good.
Okay. Yeah, so as an infection control, COVID-19, all infection control was a mess, especially at the beginning of the pandemic. We don't know anything about the virus.
Yeah.
At the beginning, they said it's airborne, so everybody went to full gear, long sleeve gowns, FFP3 mask, your visor, gloves, everything. And then after a few weeks, they said, "Oh, it's droplet." So they stepped down the PPE. They just used apron. Not even FFP3. They introduced surgical mask after a few weeks. And the most challenging part really is to reintroduce new guidelines. I don't know if you remember, Jeremy, not every single day, that's exaggeration, but probably every week there's an update on the guidance.
Yeah.
So we haven't implemented the previous one. There's a new one. So it seems like for all the clinical teams, we look like we are incompetent because they think that we are the one changing the guidelines, but they're not realizing that we are just following the national guidelines. So that's the worst part really, because of course it's understandable. The nurses, the doctors, everybody was just so anxious. They're so afraid, they wanted to protect themselves. Even if we stepped down the PPs that time, no, we wanted the FFP3, we wanted the long sleeve gowns. But what they don't realize is they're putting themselves at risk, because at that time, Jeremy, if you remember, there's a shortage of every PPE. FFP3 and all of that. And everybody's going to a self-preservation mode where they wanted to wear FFP3 to the point where they wear the same FFP3 the whole shift. When they go out, when they go and have their lunch, they're gonna put it in a plastic bag, put them in their pockets. But what they don't realize is when they don the FFP3 again, they're touching the same contaminated space, a contaminated part of the mask, and they're donning it, not realizing they're self-inoculating, and they get the virus because of that route as well. And that's one of the worst thing really, implementing all the changes in the guidance, and of course the shortage of the PPE. It's really a big problem because we don't know how are we going to manage it, to the point where we change our definition of how to use
Mm-hmm.
those visors and those FFP3 masks. We went for what do you call that again? I forget now. Sessional use. And
Okay, yeah, yeah.
sessional use is every trust got their own definition of sessional use. Yeah, one trust would say sessional use like 5 hours, or
Mm-hmm.
one trust would say sessional use when you remove them and you go to your break, throw the FFP3 mask. But the
Mm.
problem is, again, they don't have enough supply on the ward, and they reuse
Yeah,
and
yeah.
reuse them.
Oh, yeah,
Yeah,
yeah.
to the point where most of the staff are infected with COVID already, and shortage
Mm-hmm.
of staff again,
Mm.
and all that. But of course, even with those, with those challenges, there's loads of positive effect as well on
Mm-hmm.
on having COVID-19. I'm not sure if you're gonna ask me that question later, but yeah, if there's negative, there's
There's always a
positive as
positive.
well. Yeah.
Wow, amazing, amazing. All right, yeah. So what's the update naman na ngayon? Because as what you said, it changes all the time. Like if a patient becomes a
Excuse me.
COVID contact, it used to be 14 days, 10 days.
Yeah.
So update us. What's the latest? Hospital wise,
So
in general. Yeah.
hospital wise, it's
Mm.
still, as again, they left it in the executives of each trust. They
I
have the
see. Yeah.
national guidelines.
Uh-huh,
At the
uh-huh.
moment, the isolation period for COVID positive patients in the hospitals are still 10 days.
Mm-hmm.
For contacts, still 10 days.
Mm.
However, recently they've changed it to 7 days. This is in the hospital setting, yeah?
Yeah.
Yeah, because I think it's just not working. That model that they're using is just not working in
Mm-hmm.
managing the flow of patient in the hospitals. So in
Mm-hmm.
my trust at the moment, so we're following. If you're positive COVID, we're isolating you for 10 days. If you're contact, then 7 days, provided that your seventh day you have to have a PCR test which should be negative.
I
Yes,
see. I
those are
see.
the parameters. But to be fair, with all the changes, like frequent changes from 14 to 10, and in the community, actually, it's 5 days isolation now, Jeremy.
Oh, okay. Wow, something new.
Yeah, so in the community, it's 5 days. And if you're not symptomatic, you don't have to do PCR anymore. With the
Mm,
recent guidelines, I just wanted to make mention now, Jeremy, I might
mm.
forget. There is a new guidelines that will gonna be published on the 1st of April.
Yeah, yeah.
One of the changes that might affect us, nurses or healthcare workers, would be the free parking. The free parking is no longer available from the 1st of April. You remember they I think they tap into the boroughs, the councils, to provide free parking for healthcare workers for like
Yeah.
free parking.
Mm.
I think from 1st of April it will gonna be stopped, so there will be no
Oh.
free parking anymore. Secondly, PCR testing is no longer free for the community people, unless there's a
Mm,
clause
mm.
there, unless
Yeah.
they are high risk.
Mm.
If they are in the nursing home, more than 65 to 75 and above years old. But for us as a healthcare workers, still we can still access free swabbing if you like.
Okay.
What
Okay.
else did they change? Yeah, the isolation is now 5 days. Yeah, mostly those are the
In the
main
community, you said, yeah. Yeah. Okay.
mostly, yeah.
I see.
But
I see.
with the staff, if you're positive, how we manage now is that we have created a isolation team
Hmm.
when yeah, because most of the time they call infection control.
Yeah.
Basically, they call infection control for everything, even
Exactly.
for birds in their ceiling. If they're like, yeah, that's true. That's true. I'm not even lying here, Jeremy. Like if there's a bed bugs, yeah, they call us as well instead of the pest control.
Oh
If
my
there's
god.
a fungus in one of the clinical area, things very very very. It's funny, but I'm more than happy to accommodate them and
Yeah.
signpost them to right people.
Yeah.
However,
Yeah.
everything is infection control. Might be good or bad, mostly bad. If something went wrong, Oh, it's
Yeah.
infection control, or oh, infection control advised me to do this, or infection control open this one. It's always infection control.
Oh dear.
I
Yeah.
found that like really fascinating, but
Mm.
it's equally annoying as well sometimes. That
Mm.
why you're using us as scapegoat for for
Yeah.
everything, But the good thing about the pandemic, there is a cohesion between the execs, the trust itself, and the infection control. Because before, they just
Mm.
infection control us. They come here and they tell me off,
Okay.
and then yeah, there's like loads of what's the term, misconception about infection
Uh-huh,
control.
uh-huh.
Because
Yeah.
even I myself, when I was still working as a stroke nurse, if I see an
Mm.
infection control nurse out there, what now, what we have done, what have you done now, it seems like they're here to punish us. That's
Yeah,
the
yeah.
notion. But when I joined them, it's 360 change of
The
mindset.
mindset. Yeah, yeah, yeah.
When it comes to infection control, people might think, oh, infection control, they're just sitting in their office, doing nothing. But then again, those are all lies, Jeremy. To be
Mm.
honest, infection control don't have time to eat anymore. They eat while they deal with the results. During COVID, how many results? Thousands of results we're dealing every day. We document
Mm.
them, we phone them, to the point where,
Mm.
you know what? Let's not do this anymore because it's just too much. There's at a point, like at the very peak of the pandemic,
Yeah.
the trust just decided, okay, we'll just document them, and we know for sure all of the words anywhere in the trust are infected. So
Yeah.
we arrived to that point. But then again,
Mm.
it's just what I would say with my trust with my trust during the pandemic, we managed to rebuild that relationship, open communication. Like the communication has improved. They
Mm.
listen to infection control. They value the input of infection control, and they appreciate infection control more than ever. Because before, they don't
They
appreciate
don't.
infection control. I'm sorry
They
if
just.
there's like infection control nurses here, but that's just my personal view. Like, yes, one, two, three people would appreciate, but then again, not as when, oh, they've managed to make that wound healed like quickly because of this new innovation and things like that. They will post that on our what's that, intranet,
Internet. Yeah, yeah, yeah.
Yes, but then again, thank you to COVID, our infection control is always in the intranet. But kidding aside, yeah, definitely. It's a very, very eye-opening, and I
Yeah.
think it's a once in a lifetime opportunity that I managed to work with infection
Mm.
control specialists in the
Mm.
national level when I joined the Nightingale London Hospital.
Wow, I see. Yeah, yeah,
Yeah,
yeah.
so that's one thing that the pandemic has brought to me as a person and as a professional. I
Mm.
managed to get involved nationally during the pandemic, and I will be always grateful for that. I'm not grateful that COVID came, but
Mm.
COVID is there. So
Yeah,
what we can do is just to support each other, and
yeah.
take all the opportunities to help or ensure that all the staff, all the patients are safe at the same time, isn't it?
Wow, amazing. Thank you very much for that. Thank you, thank you. And let's just welcome all those who are coming to join us as well. Charito Rivera, welcome here. We have Rosanita Istort Gargarita, welcome here. We have
Roast.
Elizabeth Clover Eugenio, welcome here. We have Nenita Gata, and we have some comments in here. We have Matthew McDonald. Thank you. Good evening, Jeremy and Mark. Thank you, Matthew. We have Evangeline Martinez. Bravo, Michael Mark Dalauidao. Keep going, brother. And we
Thank you.
have Sigs dito sa countryside, dekada ang career growth. Punta na sa London. Ayan. Stacy's Guerra, funny to think infection control meet germination control. Oh my God.
It's like termination control. Termination.
Ayan, we have Rosanita Storgargita. Well done, Mark. Ayan.
Thank you, Nang Rose.
We have Mini Klepaska. Mark, you are an amazing leader and astounding regional director, facing challenges with strength, determination, confidence is what matters, and you have done it. FNA UK family is so proud of you. Filipino pride. Yeah, thank you.
Thank you, Miss Minnie.
And we also have Dalauidao Brian Simon. Yeah, thank you. Welcome here. Welcome. All right. So, I think there's something which is the government will be implementing soon as well. I'm sure you heard about this one. That they're lifting all restrictions and all these lateral flow tests will no longer be free. So, and of course you're a modern matron, you're in a position. So I just want to know what is your point of view about this one. They were saying we built something already and we don't want that crashing because of the implementation of this government, to lift all restrictions. And then, of course, they have the reason themselves, yeah? And then lateral flow test will no longer be free. But just want to know your point of view about this one. But before you answer that one, I just would like to pause for a commercial break and we will be right back. Don't go away because we're not going away. Stay tuned.
Wash your hands or sanitize your hand. Wear your face mask and maintain a safe distance.
There, out in the darkness, a fugitive running, fallen from God, fallen from grace. God be my witness, I never shall yield till we come face to face, till we come face to face. He knows his way in the dark, mine is the way of the Lord. Those who follow the path of the righteous shall have their reward. And if they fall as Lucifer fell, the flame, the sword's touch. In your multitude, scarce to be counted, filling the darkness with order and light. You are the sentinel, silent and sure, keeping watch in the night, keeping watch in the night. You know your place in the sky, you hold your course and your aim, and each in your season returns and returns, and it's always the same. And if they fall as Lucifer fell, you fall and flame. and so it must be, and so it is written on the doorways to paradise, that those who falter and those who fall must pay the price. Lord, let me find him, that I may see him safe behind bars. I will never rest till then. This I swear by the stars.
Are you sure you're in the right career, Jeremy?
Thank you, thank you.
Was really good. Good.
Oh, thank you, thank you. I always serenade my special guests here, no matter if you're a girl or a boy. I always serenade my
Yeah,
special
that's
guest
that's
here.
100% talent there.
Thank you, thank you. And yes, going back to my question. So, what are your thoughts? The government is lifting all these restrictions, and lateral flow tests won't be free anymore.
Yeah, before I answer that, Jeremy, I just wanted to make a disclaimer here that my opinion is not the opinion of the trust that I'm working for, but this is just this is just my own opinion. Yeah.
Yeah,
So
yeah.
when they step down the wearing of surgical mask in the community, I
Mm,
wasn't really happy because I think it's too soon. And sure
mm,
enough, after that, there's a surge again of cases,
mm,
not only in London but the entire country.
mm,
Um, and then I've heard that there gonna be changes, just like what you've said about the LFT being not free anymore
mm,
for the community people. And in my own point of view, I'm talking as an infection control at the moment, not as
mm.
a layman.
Yeah,
Yeah, so as an
understand. Yeah.
infection control, because I think they've studied everything really. Um, with the amount of money that they've spent during the pandemic, I think it went up to about 15.7 billion just to cater for all this testing, rapid testing,
Mm,
these PPEs. It went up to about 16 billion, and of course. Uh, we need to recover from
yeah.
from what the government has spent as well, but the decision that they're taking now to 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 step down these precautions and to step back on giving free LFTs, I think it is okay, because at the moment, compared before,
Mm,
we don't have vaccine.
yeah,
I
yeah.
think majority of the people now in the UK, we are all vaccinated. We have our first, second, and
Mm,
we even have our booster, isn't
yeah,
it? So when
yeah.
it comes to acquisition of the virus, it's less compared before. That's why
Yeah.
they invest a lot of money. And now I'm not saying that they're trying to to get it back, but then again, I
Yeah.
think it's the right time for us to recover. But
Mm,
having said that, Jeremy, they have that plan, but again, they also have a plan in case there's a new variant again
yeah.
na magpapakita. They have a
Yeah, yeah,
plan.
yeah.
So it's not that we don't have a supply of lateral flow tests. That's why they're cutting down the free
Mm-mm.
lateral flow test kit. However, I think they're preparing for if just in
Yeah,
case
yeah.
there's another surge or another
Search, yeah.
variant that will
Mm-mm.
appear. Just like right now, they said that the Delta and the Omicron joined together. They call
Oh
it
my
Delta.
God.
Yeah,
So
they
what do
they,
they
they,
call them then?
they call it Deltacron. I don't know if
Yeah.
you've heard it, but no, I'm not joking. This is true.
Deltacron. That's a nice
No,
one.
I'm not joking.
Deltacron.
Yeah,
Wow.
yeah. They call it Deltacron. Yeah.
Deltacron. Wow.
So yeah,
Amazing.
yeah, so it's just I think the government is
Uh-huh.
taking these actions based on what they've assess what's going on at
Mm-hmm.
the moment.
Yeah, yeah.
In fact, all the elderly population 70 to 75 years old and above, they're having their second booster this
Oh, okay.
next season. Yeah, so they're offering a second booster just to give them more protection, especially they
Mm,
are in their 70s and 75s. And of course, we know that their immune system is really weak compared to people
mm,
who are fit and well. So I think it's just a good move from them. And yeah, so at the beginning, when they said no more precautions in the community, I really said 100% no, 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 it's too soon, it's too soon. But but this coming changes when it comes to the
yeah, yeah.
implementation now. I would support them on this one, Jeremy. To be
Mm-hmm.
honest, because I understand the fact that we are mostly vaccinated,
Yeah, yeah,
and I'm not saying everybody's vaccinated. There, even though you are vaccinated now, you still at risk to have that.
yeah, yeah.
Even if you
That's
had
true.
COVID before, you can still have COVID second time,
I
maybe
know.
third
Yeah,
third
yeah,
time as well.
yeah,
Yeah,
yeah.
that's why I'm urging everybody, for those who hasn't received their vaccine, unless it's contraindicated. But I'm not sure what contraindication would it be. But I'm encouraging you to have your vaccine because it would really help. It will actually it helped. You've seen it. The number of cases went down when
Yeah, yeah.
we managed to give the vaccines. Majority of the people here in the UK, and not only in the UK but around the world, really. Yeah, but yeah, Delta Cron is here,
Delta
so
Cron.
the,
I
the,
love
the,
that
the
Delta
difference
Cron.
the difference is that the difference of Omicron and the Delta Cron, the Omicron mostly asymptomatic, but
Yeah,
you
yeah,
know, but they're not really what's the term? They're not really. It's not fatal. They're
yeah, yeah,
fine.
yeah, yeah. It's just
You
there.
know,
Yeah, yeah.
yeah. But unlike the Delta before, which is like
Mm-mm,
the death rate has increased and all that. So the Delta
mm-mm,
Cron is not as bad, but still, I think on the when was that, on Tuesday or Monday? 28 on Monday. I think
mm-mm,
they've managed to on the survey or the statistics. I think there's still like 14 people died in one day,
mm-mm.
which is in one day. And
Okay.
there's when was that? It was last week. When the peak again of the COVID, and they said there's
Mm.
Deltacron. We have at least 24,000 in a day positive
Wow.
cases. Yes, I was
Mm-mm,
surprised. In my trust, we saw, yeah, there's an increase of cases. But the
mm-mm,
difference now, as I've mentioned, the difference now with this surge, most of the positive patients are the ones who are already an inpatient. I think
I see. Yeah, yeah, yeah.
it has something to do with the stepping down of precautions in the community. And even with the visiting policy within my
Yeah.
trust, we kind of lax. I mean, not lax, but relaxed. That is not lax.
Mm. Yeah, yeah.
Relaxed a little bit, and we allow more people than we normally allow during the pandemic. And I think,
Mm-mm.
and given the fact that the variant that's circulating at the moment, you can be positive but asymptomatics, of course, you wouldn't know that you've got the virus, and then you went to the hospital and visit your family member who's sick or
Mm-mm.
maybe immunocompromised. Of course, they can definitely easily get the virus. That's
Yeah,
why
yeah.
it's not only at King's. I think it's nationally. Even my colleagues in different hospitals, they are saying the same thing, that the number of cases are not the one who's being admitted in the A&E, but
Yeah,
those
yeah.
patients who are already an
Already inside the
inpatient.
hospital. Yeah.
Yeah,
I see. I see.
yeah. So it was just it's a shame because before that surge, King's College Hospital is one of the, I think it's mostly top one or top two who has the lowest hospital acquired COVID infection, like in a monthly reporting, and we're so happy. And then after that, it's going up.
What's up?
I thought it's only at King's, but then again, nationally, I think at
Nationally.
some point they've said that it's about 25 to 40% increase in the number
Mm-mm.
of COVID positive patients. Yeah.
But at least they are like less fatal, less fatal
Yes,
compared
yes,
to what
less
was
serious.
before.
Yeah.
Yeah, yeah, yeah. Wow.
Mostly asymptomatic, to be honest.
I see, I see. So let's just keep it like that, No more deaths.
Yeah, no more COVID.
No more
No
COVID.
more
Yeah,
COVID.
that's
Yeah,
the
no
main
more
thing.
COVID.
No more COVID. All right.
Yeah, but
Amazing,
the thing,
amazing.
Jeremy, sorry, I just
Mm.
wanted to reiterate this.
Uh-huh.
Uh, During the peak of even the first peak of the first wave of the pandemic, yeah, everybody
Mm-mm.
was so afraid. Actually, this is one thing that I wanted to thank COVID because the compliance of hand hygiene in the hospital, 100%. They're very
Yeah.
good. Yeah. Um, in every pandemic, there's the one scientist has mentioned at the beginning of the pandemic. In every pandemic,
Mm.
expect there will be second, third, fourth wave of the pandemic.
Mm. Mm.
Yes, and it's true. It happened. It's
Mm.
because of the it's because of the practice. Like, okay, peak of the pandemic. There's loads of cases. I'm a healthcare worker. I have to wash my hands. I have to follow every single precautions
Mm.
there is.
Yeah. Yeah. Yeah.
And then when they observe that the number of cases go down,
Yeah.
their
Yeah.
practice go down as well, or it's gone.
Yeah. I know.
And then the
Human
new
nature, isn't
wave,
it?
yeah, the new wave,
Yeah. Yeah.
comes again, and yeah,
Yeah.
that's what really happened. That's why we have this surge, different surge. Every
Mm.
after one
Mm.
surge, there's another one. But then again, yeah, but to be fair, still, I would attest in my trust, especially that the infection control, the awareness of the infection
Mm.
control measures was highlighted by this pandemic, and that's something that I wanted to thank this pandemic really, because it made it's making our job easy, because I don't have
Mm.
to say again and again and again,
Yeah.
just one thing
Like
they know.
before.
Yeah, yeah. Somehow it really helped, and yeah. So
Well, that's really good. There's always a positive and negative in every
yes,
situation.
definitely.
Yeah.
That's definitely.
Amazing, amazing. So, you're a modern matron that's band 8. That's considerably a high position, in nursing here in UK in London, and coming from a foreign land, where we're trained back home, and as what the society calls us, ethnic minority, but here you are, you are a modern matron. What do you think is the key, for the sake of all those newly arrived nurses, before it was just like a dream that, oh, we're gonna be nurses in UK, and little did you know that one day, once you're here in UK, you'll be a modern matron, of a big hospital trust in London. So what do you think is the key factor that has really contributed to your achievement of where you are right now in nursing?
Yeah, just like many other Filipino nurses, we are known to be good in what we do. I
Mm.
could say that, like, you know, face to face. That yeah, it's very true that we are known to be very good nurses. At the same time, we are also known to be submissive.
Mm. Yeah.
At the beginning, I was, but I think you need to learn when to become submissive and when to become not aggressive but assertive. I should say.
Assertive, yeah, I think that's the term, yeah.
Assertive, yeah. Because most of, especially if you're new in the country, Jeremy, of course,
Mm. Yeah.
sir, mom, that's very common to us. You say sir, mom.
Yeah, yeah.
Every time I meet new nurses, they say sir, sir. No, 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 no. You don't have to call me sir. You call me by my name, and
Yeah.
hindi uso ang sir dito, tsaka ma'am, di ba?
Oh, yeah, yeah.
Yeah, so I think the key for me, Jeremy, I work hard.
Mm.
It's not easy.
Mm.
I'm just so fortunate that my mentors, my managers, see a potential in me, and they really develop me and
Mm. Mm.
help me achieve what I have achieved at the moment. Yeah, so I think what I can say to everyone, those who are still working for their career, or even for those who
Mm.
are still in the Philippines, you can do it. I
Yeah.
think you can do it. You just have to work hard for it. I believe that there's no shortcut. There
Mm.
is no shortcut. You need to work hard for it. You need to
Mm.
show that you deserve that position. You need to show that you deserve ano tawag doon? That nakalimutan ko yung tawag. Very common yun. That Promotion, yeah.
Promotion,
You
promotion.
deserve that.
Okay, okay.
You deserve that promotion. I
Yeah,
just
yeah,
wanted to mention to everybody, just do what you think is right,
yeah.
and just follow the guidelines, just follow the rules. I always live by this. Ano bang tawag? Kasabihan ba? Hindi mo kasabihan, but I always believe na yung sinabi nila na you need to practice what you preach.
Mm.
Especially with my role as an infection control, how will I be able to encourage everybody to wash their hands if they see me not washing my hands? That's
Yeah,
why
yeah,
every single time I enter a clinical area, I have to wash my hands. I have
yeah,
to
yeah,
be very conscious enough to
yeah,
remind myself that everybody's looking at me, and if they see
yeah.
me, not observing the things that I wanted to implement, then of course you won't gonna get their compliance, you won't gonna get their respect, you won't gonna get their
Yeah, yeah.
cooperation. And
Mm,
that's my guiding principle at the moment, if you like,
mm.
Jeremy, that
Yeah, yeah,
I've
yeah.
been, even when I was in the stroke unit,
Mm, mm, mm.
if I always like to have students with me, because for sure I'm gonna do the right thing, I won't gonna do shortcuts at all. And
Yeah, yeah.
thankfully, yeah, I never do shortcuts. I always tell my students, you do this, you do that, and I'm so thankful with it. I'm so grateful because of that. I was forced, not forced, but I really, I'm type of person, I'm type of leader who value guidelines, who value yung rules and regulations, if you like.
Yeah, yeah.
And yeah, so that's the thing that I wanted to say, really. When you come here, or when you're here already, just make sure that you abide with the trust policy, because if you follow any rules and regulations, any standard operating procedure, you won't gonna go wrong.
Yeah, yeah,
And
yeah.
make sure you show to them that you're good at what you do, even
Mm.
if even if you think that they don't notice it. No, that's not true. Your
Yeah, that's true. That's
manager,
true. Yeah,
your matron, they
yeah,
see
yeah.
that, and
Exactly,
then they
exactly.
talk to each other.
Yeah.
And just continue what you do best, and
Mm.
you know no, they will notice it, and of course God will intervene, and God will give you, if you deserve that position, God will give you that post. Yeah,
Wow,
just like
amazing.
what happened to me on this post, Jeremy,
Mm-hmm. Mm.
the band 8A post. um I applied for the post,
Mm.
even for me, I think I'm not ready, but they say I am ready, you know
Mm. Mm.
and I hold on to that. It's okay, I'll gonna apply for this job. There is this one very senior infection control who's been there for like 20 years, I think, in the post. They're offering her the job, but she doesn't want to take the job.
Mm. Mm.
She's done it like in charge before, but she said, oh, I don't want to do it. So when they
Mm.
talked to me, they encouraged me to apply, and I said, "Oh, I don't want to apply because I want her to apply." Like it's like that mentality in the Philippines, like
Yeah, yeah, yeah,
seniority,
yeah. Yeah, yeah,
seniority. And
seniority. Yeah.
yeah, out of respect, I want her to apply. Maybe when she's retired, then I'll apply. That
Mm.
kind of mentality.
Mentality. Yeah,
But
yeah.
then again, no, she's not going to apply. So I applied.
Yeah.
But you know
Mm.
what? During the interview, I saw her and she applied, and I said, "What's going on here?" I was just flustered and like, oh my goodness. I said, oh, I didn't even tell her that I applied. So at the back
Mm.
of
Mm.
my mind, like, oh my goodness, did I disrespect her or whatsoever? But at the end of the day, I went to the interview. Still, I
Mm.
went to the interview,
Mm.
and here comes the decision time.
Mm. Mm.
There's four of us. I think there's two from outside. Actually, one
Mm.
from UCLH and one from somewhere else.
Yeah,
And
yeah.
they're all like in that level already.
Level. Yeah, yeah.
uh, because the main thing that I said, I'm not ready yet, because I'm only like 4 years in infection control, and most of
Mm.
them are like more than 10 years in infection control experience. And then when the result came, and they said like at first they called me, oh Mark, we cannot give you the result today, because
Mm.
we have two people that were considering for the post. We have to
Mm.
discuss it with the chief nurse tomorrow.
Mm.
Okay, so here comes the next day. So they rediscuss. again because they cannot decide who they wanted to pick, and they told me like actually one of them is you, and one is the senior nurse that I was talking about.
Okay.
And then it ended up like Mark, uh, you've done very well with your interview. They say things like
Yeah,
that.
yeah,
And
yeah, yeah, yeah,
I'm so grateful that they said that as well. But then again, they said we gave the post to to my senior
yeah, 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 yeah.
because of the experience. And I said, I completely get that. I would rather have
Mm,
her to manage
mm.
our team than, from outside because they have to adjust again with the
Yeah,
culture in
yeah,
the
yeah.
trust and all of that. So to cut the story short, Jeremy, after a few weeks,
Mm.
the senior nurse decided to leave the trust.
Okay, I see, I see.
And then they gave me the post.
Yeah, yeah,
So that's how it happened. So if it's God's will, Jeremy, if
yeah,
it's
yeah.
for me, it's for
It
me.
will
And
be for
I
you.
just wanted to all give glory to God because I think it's time for me to have that post. And I'm so
Yeah, yeah.
grateful that I accepted it. And now at the moment I'm just so happy with the team that I'm working with. It's a very good team, and I wouldn't change it for the world. And yeah.
Wow, amazing. Very inspiring, just like what you said, just do what you do best, just do your best, just show what you've got, and then it won't go unnoticed, and then
Exactly. Yeah.
opportunities will open for you.
Yeah.
Opportunities will open. Amazing, amazing, amazing. That's really good. Um, and at this point, I just would like to welcome as well Carlo Ismael Agraviador Panotes. Yeah, welcome here. We have Joe Feli Corazon, Charito Rivera. Yeah, let's just read the comments in here as well. We have this is good. I hope Mark will be back to Germination Show. We learn a lot from you and Jeremy. Wow. Thank you,
Thank you,
Daisy.
Daisy.
Makakarating din ako dyan, Jeremy, kapag ipinagkaloob ng Panginoon, pangarap ko makarating dyan. Yes, why not? Why not? Everything is possible. And we have Joe Feli, congratulations. And we have Miriam Insyong De Vera, Mark, bravo, isa kang katiwala ng Diyos. Oh, nice song and nice voice. Praise God, Jeremy. Thank you very much po. And yes, and thank you, Marvic. And thank you very much. And yep.
Everyone, and Mark, maybe you're surprised with this message, and thank you, Jeremy, for giving me an opportunity to give a surprise message for Mark. Well, I just want to tell everyone that Mark is really a good man. Truly, it has come from my heart. Wala akong masabi sa kanya. He's very kind, gentleman, marunong makisama, at napakasipag. Walang kapaguran. He wanted to give a good life for his family. And I'm so blessed to have you, Mark, in our family as husband of Michelle. At maybe kahit mawala ako, Mark, hindi ako natatakot na maiwan ko si Michelle sa'yo because your love, I saw your love, the way you take care of Michelle and the family, the way you handle as a father. I am so blessed. We are so blessed. Yung pangamba ko before, natakpan yun. Because I witness every day how you become a good man. And every woman desire na magkaroon ng husband na katulad mo. And I really thank God for that, Mark. Stay where you are. I know na magiging matagumpay ka pa. You'll be successful. But lagi kong sinasabi, Mark, being a successful is being with God. At make always humble. Alam ko namang humble ka. But make it always humble. Because God said, ang nagpapakataas ay ibinababa at ang nagpapakababa ay itinataas. You know that. And God bless you, Mark, for your interview. And I believe na you can make it. We are so proud of you. Even your parents. God bless everyone.
Wow.
When did you get that, Jeremy? Paano mo na-contact si Mami?
There's a lot of surprises here in Germany.
I know. I'm about to say something else kanina related sa career progression, but yeah, and I just wanted to thank my mother-in-law for giving that very heartwarming message, and I give glory to God for everything. Really, He changed me, and I just wanted to reassure her that she doesn't need to be anxious for anything. I'll look after her daughter and the rest of the family. Yeah.
Wow, amazing. Thank you po. Thank you, Ma'am Miriam. Yeah, thank you for that message. And there's a comment here, Kaina Maris Zapala. Thank you for always supporting us and our team. You always go and beyond. Thank you for all the support in work and in our professional lives. Michael Mark Dalauidao. Yan. Thank you, Kaina Maris Zapala, for that comment. Wow, amazing. Any top tips? Any top tips for newly arrived nurses here?
Oh, just before that, Jeremy, I just wanted to mention because I think was it Sadiq? What's his name? The one who wants to come to London? Yung kanina may nag-comment, di ba? Yung gusto,
Is that the one?
yung makakarating din daw siya dito sa...
Yeah, I think that's the one. Yeah.
Oh, this is Marvic. Sorry. So
Yeah,
Marvic.
yeah.
So I just remembered this afternoon I've attended a forum about equality, especially with the BAME community. We all know for a fact that hindi there's kumbaga comparing sa number ng mga nandyan sa highest position karamihan talaga is syempre white, 'di ba? But ilan-ilan yung mga yung mga nasa BAME community. I'm not only talking about Filipinos pero syempre lahat ng mga nasa Black Asian minority ethnic group, 'di ba? It was just interesting kasi there's a group na talagang nagtataguyod that encouraging BAME community people to dream and to achieve their dreams na masuportahan na mag climb sa ladder.
Yeah.
I think what I would recommend is don't just be afraid to step. Kasi once you've taken that single step, magtutuloy-tuloy na yan. Just believe in yourself and of course, believe in God. And just try to connect to right people. Yeah, sometimes they say it's not what you know, but it's whom you know. At some extent, I would agree with that one as well because in this kind of I'm not discrediting your knowledge or skills, but then again, sometimes it's good to network. And if you network with other specialization or other people, there will come a time that somehow they'll be able to to help you. Let's say, oh, we've got opening here. Would you like to apply? O yung mga ganung opportunity, di ba?
Yeah,
so,
that's true.
So that's a good practice as well. And just be involved. Just be involved in the community. I just wanted to take this opportunity now to thank Filipino Nurses Association United Kingdom. Just be involved in such an organization kasi ma-develop ka din with the caliber of all the people na kasama mo sa organization. You're learning from each other and you're gonna be inspired by them as well. Especially with the FNA UK members and officers, diba? There's loads of achievers there. There's loads of sobrang invaluable na mga contribution na ng mga Pinoy pala sa UK, diba? I was so surprised. Like, dati wala akong kakilalang mga ganong kalidad. But then again,
Mm.
joining this organization, FNA UK, has opened a lot of opportunities, has opened a lot of opportunities for me as well. And kumbaga natulungan nila ako personally, professionally, of course, at the same time. And yeah. So just take that first step, take
Mm.
that leap of faith, and for sure, wag ka nang matakot kasi wala namang mawawala sa iyo. Just take kahit ilang beses
Yeah,
ka
yeah.
pang kahit ilang beses ka pa, even how many times you fail to get that promotion or to get that post that you wanted to have, for sure, everything happens for a reason. Everything will be in God's perfect timing. So the best thing that I would probably advice to everyone, apart from of course unahin mo si Lord sa lahat ng ginagawa mo, honor him in every single step of the way. I would like to say I would like to recommend na na just believe in yourself, and don't hesitate, don't stop yourself of achieving what you wanted to do. And make sure na talagang magtrabaho ka din. Syempre hindi naman pwedeng
Mm.
ibigay lang sa'yo basta-basta, di ba?
Yeah.
So you need to work hard. You need to work hard, and you need to show them that you deserve that promotion. And for sure, lahat tayo, I'm talking about Filipinos now, we can do it. Kung nagawa ng mga nauna sa atin, nagawa ng mga kabatch namin, magagawa at
Mm.
magagawa rin ng mga susunod pa. And let's just have that mentality, to pull each other, not to, pull each other up. I mean,
Yeah,
not
yeah.
to pull each other down, okay? Kasi napakalaking factor nun eh. Especially with FNA UK, you can feel
Mm.
the genuine care, the genuine, alam mo yung genuine na talagang pagsuporta nila sa'yo to develop your career dito sa UK. So let's
Mm.
let's 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 be that leader na we're trying to support our subordinates, our colleague, to move up the ladder. Wag kalimutan na natin yung mga crab mentality na sinasabi, 'di ba? If may na-achieve yung kababayan natin, let's be happy
Mm.
for them. Your time will come. Your time will come. That's for sure. So, lagi lang natin tatandaan 'yon na alam niyo 'yon, ang huli ko nang masasabi, Jeremy, lagi ko lang sinabi. Ang huli ko nang masasabi, Jeremy, is don't compare yourself to anyone else.
Yeah. Really
You
true, really true. Yeah,
don't
yeah.
don't don't compare yourself to what I achieve or what your other colleagues have achieved.
Mm.
You
Mm.
have your own run to race. You have your own finish line to finish. You
Yeah.
have your own goal to achieve. So never. Kasi every time you compare yourself, madidishearten ka lang. Syempre, di
Yeah.
ba?
It's a
Especially kung
self-sabotage.
yeah, especially if I've been here longer than that guy or that woman. How come na mas nahigitan niya pa ako, 'di ba? Let's
Mm.
just have that mentality of being happy for what our kababayans have achieved, and for sure, if you only focus and you only dedicate as well your craft,
Mm.
your knowledge, your skills to what you're doing, you'll get there.
Exactly.
You'll get there.
Amazing.
You'll get there.
Yeah. Sabi nga nila, your competitor is not really your competitor. Your competitor
Yes.
should be your inspiration. Kasi
Exactly. Yes.
you have to think, oh, paano niya kaya nagawa yun? Yes, I've got more experience. I'm longer than him in this trust, but then he managed to get the position. So, yes, your competitors, but make it as an inspiration for you. How did he get that one? How did he get there? So you have to learn from each other. That's really amazing. And what one main big life lesson that you can share to us that you have learned in your journey, from the Philippines and going here, and now you're a modern matron? What sticks out in your mind? Now you would like to share to us one main big life lesson you've learned.
Just the main thing really is just being grateful. Being
Mm.
grateful to whatever you have at the moment, and whatever you receive at the moment. Just be contented. That's it really. That's the
Mm.
main thing. Because when you are not contented anymore, that's the time you do
Mm.
things, sometimes foolish things. For you to
Mm.
achieve this, you've done some foolish things, and it's at the end of the day, it's not good. So I would love to encourage everybody just to to enjoy the life that we have here, because not all the Filipinos or not all nurses
Mm.
has the opportunity to come here. So if you're here and you're listening at the moment, let's enjoy life. Let's show the love, the care. That that's another thing that I love during the pandemic, Jeremy. Everyone, regardless of race, we were
Mhm.
united. We help each
Yeah, yeah.
other. Anyway, I'm digressing with.
No,
Just
that's
yeah,
fine. That's fine. Yeah.
yeah. So it's just that one thing that you just be grateful. You just be grateful because for sure God will never give us any trials that we cannot surpass.
Yeah. Sabi nga
That's
ni
for
Gary
a
V,
fact.
no? Sabi
Yeah,
nga ni Gary V, he won't give us what you can bear. Di ba?
yeah.
Napakaganda
That's
ng linya na yon, di ba?
exactly, and it's true. It's true.
Yeah,
It's true. He
that's
won't give
true.
us whatever that we cannot bear because at
Yeah.
the end of the day, even if you are in that trial period, God will always the one who's gonna make a way for you to
Mm,
become victorious out of that trial,
exactly.
diba? So yun, so just be happy, just be contented and be grateful for everything that you have at the moment. And yeah, just always put God at the center
Yeah.
of everything, and for sure you're gonna fly high. You're gonna be flying higher than anyone that are in the high positions at the moment. Just enjoy life. That's it.
Amazing. Yeah, that's what they call the attitude of gratitude. Yeah.
Yes.
Attitude of gratitude.
Spot on, yeah.
Amazing. Amazing.
Good evening. Gulat ka, no? Yeah. Bro, I just want to tell you that we are really proud of you. Especially mom and dad, they're really proud of you sa achievements mo. And, yeah. Alam mo naman, noon pa man, ever since, you always make us proud. And we are very, very lucky to have a kuya like you. You're the best. And God blessed you and your family. And sana huwag ka magbago nung. We love you and we miss you. Bye-bye.
I don't know
Thank you,
how.
Brian.
I don't know how you managed to to ask him to do that because he's very shy. My brother, he's my youngest sibling.
Oh,
He's
okay.
yeah. Actually, my mom, my dad, my brother, my sister, they're all in New Zealand. I'm the only one here in the UK.
Oh, I see.
Yeah, so yeah. Thanks, bro. So
Shout out sa lahat ng mga taga New Zealand. Ayan, lalo na sa family ni Mark
yeah,
Dalauidao. Dalauidao family, yan. Yan. Thank you for your support. Thank you for the video messages and everything. Surprise video messages, in fact.
yeah, indeed. I was surprised. I was surprised.
All
That's why he's
right.
been asking me, what time is it? What time is it? Has it started? And all of that. Like, what's going on? I didn't even like click in my
And he
mind that
was Yeah, and he's here actually. I saw him earlier. Yeah.
yeah,
Let's all
yeah, yeah.
welcome as well Francis Michael Fernando. Yeah, the founding father of Filipino Nurses UK,
Yes.
FNA UK. Yeah. And we have Felix Geraldine Yebra. Yeah, welcome here, FNA
Hello
UK.
po.
Yeah, and Cathy Rowe, welcome here. Thank you. Ayan. Ayan. Let's have a little bit of icebreaker. Okay, so basically, I'm going to show you a picture and just describe in one word. Let's see how much you remember the Philippines.
Oh
You've been
dear.
here like how many? 10 years already, or
Yes,
something?
yes, yes.
Okay, okay. Just describe in one word, or what comes into your mind when you see this picture, or I'm sure you know these personalities. Okay, first one. Describe in one word.
Oh, apologies. I don't know this person.
Elevendia.
No.
Erase your heads. Really?
No,
Oh, that's
no,
a
no, no.
surprise.
Yeah, I'm not
That's
I'm
very
not into
interesting.
music. That's probably the reason why.
Okay, okay, no worries. How about this one? I'm sure you know this personality.
Chismis.
Chismis.
Yeah.
Ayan. Good, good.
Marites.
Ito.
Kabayan.
Kabayan.
Magandang gabi, bayan.
Magandang gabi, bayan. Ito.
Florence Nightingale, yeah. Penicillin. Penicillin.
Penicillin.
Talk show host. Yeah.
Talk show host. Ayan. I hope kilala mo to.
Oh, yeah, he's a comedian, yeah. Vice
Yeah.
Ganda.
Vice ganda. Good, good, good. Ito.
Who's that? Oh, sorry, hindi ko po siya
He used to
kilala.
be he was Rostum Padilla before.
Really?
Yeah. Now he's Bibi Gandang Hari.
Oh, I've heard that name. Pero I didn't. Rostom, okay.
Yeah, Rostum Padilla. Yeah, that's him. How about this one?
Pac-Man.
Pac-Man. And how about this one? I hope kilala mo to.
Filipino Pride.
Ayan, I hope kilala mo yan.
Kilala ko siya pero hindi ko alam yung pangalan niya.
Any
Is he a
song?
singer? Is the singer as
Yeah,
well?
singer. Yeah.
Oh, it's not Saturno. What's his name?
Wency Cornejo.
Oh, Wency Cornejo.
Yeah, after
Yeah.
image. Yeah.
Yeah. Not
All
Saturno.
right. How about this one? Just random.
Oh, Mr. Bean.
Describe
Yes.
it one word. Describe it one word.
Funny.
Funny. And if he is funny, how about this one?
Borat. Funnier.
I thought you were gonna say indecent and scandalous.
Safe.
All right, we have a comment here. Christine Kit Dalauidao Gulan, proud sister here. Thank you, Christine. Welcome here in JhermiNATION. Wow, amazing. So, just out of interest, if you're not a nurse right now, what would you be doing? You think, if you're not a nurse?
That's really a difficult question, Jeremy. I don't know. I don't know kung anong ginagawa ko yun if I'm not a nurse at the moment. Honestly.
You can't think of anything.
If I'll stop working as a nurse, probably I'll go to sell insurance.
All right. Okay. Yeah, why not?
Sell insurance. Yeah, so if you want insurance, bili-bili kayo sa akin.
Yeah.
Promote ba? Actually, that's my part-time at the moment, Jeremy. I'm a protection advisor as well.
Oh, there you go.
And I can assist you with all your protection covers, life insurance. Yeah.
There you go. If you want life insurance and any cover, Mark Dalauidao is here. Yeah.
Yes.
Amazing. See, we're uncovering all these things. All right. Another $1 million question. So you're a modern matron, band 8A. You're young. What's next? Where do you want to go after that? I mean, that's relatively, like a high position already.
Yeah.
What's the plan?
In infection control, there's like not much option. If I wanted to stay as infection control, then the next one would be to become a deputy director of infection control. That would be nice, isn't it?
Yeah.
Or even just the deputy director of infection control for the meantime.
Yeah.
So yeah.
Why not?
I'm also like trying to venture into more. I know I'm doing some leadership role now, but like leadership out of infection control, like to be some of our Filipino na colleagues na naging director na or deputy director of nursing and all of that. Yes, I just wanted to to improve as much as I can. If there's opportunity, I will definitely go for it. And I wanted to encourage everybody to do the same thing. Just don't be afraid. Go
Just
get
go.
your dream.
Just do it. Amazing. Okay. So before we wrap this up, I always ask this question to my special guest. I call this the dinner question. Have you had dinner already?
No, not yet.
Not yet. Okay, you're gonna have dinner soon. But my question goes like this: the dinner question. If you're going to have dinner with somebody, anybody in this world, even though they're no longer living, no longer with us, who is this person that you would like to have dinner with? Why and what question would you ask this person? Anybody that you can think of.
Does it really need to be a celebrity or
It doesn't
not
matter.
really?
Yeah, not really. Anybody you can think of.
I'll gonna have dinner with my wife. Yeah, and I'm
And
gonna
she's
ask,
listening right now.
and probably I'm going to ask her why me. Yeah, because honestly, like there's lots of people, like people who we know, and all, they always say, "Oh, Mark, you're so lucky. Your wife is so pretty," and I'm so grateful for my wife. She will always rebuttal and say, "No, I'm the one who's lucky. I've got the best husband. And, I've got the most
Wow.
faithful husband." And then that's it. And that's the thing that I wanted to ask her. Why me? I know, I might know the some of the reasons, but I wanted like to have that opportunity as well to spend time with my wife since we have our three kids. We never had that opportunity really to to go out and have a dinner just by ourselves. And that I think it would be a very good time for both of us, especially we're
Wow.
celebrating our 10th year wedding anniversary soon. So yeah.
Wow. So advance happy anniversary.
Thank you.
Ayan. Advance happy anniversary to you.
Thanks.
And ayan, Brian said dinner with Inang Tinay too.
Yeah,
Yes,
yeah, that's
yes,
that's
yes.
my
Mm,
that's my grandmother from my mother's side who passed
I see.
away last year. Yeah.
Oh, wow. All right. So, Mark, it's been really a pleasure. I really enjoyed it. We had a lot of laughter during your interview, and we've learned a lot as well. And I'm sure I'm very uh, guaranteed. I'm very positive that our live audience has learned a lot, especially those who are newly arrived nurses here and nurses who are still trying to find their way. Where to go and everything. But I'm sure you've given them an insight and an inspiration on how to get there and what to do next. So,
Yeah.
Mark, if there's anything that you would like to say, you would like to say thank you to, and of course,
Yep.
invite our live audience or our kababayan and nurses to join our group, the Filipino Nurses Association UK. So, the
Yes.
floor is yours, Mark.
Yeah, I'm about to ask you. Yeah, actually, Jeremy, the pleasure is mine, and thank you for inviting me to be one of your special guests on your platform. What you're doing for the Filipino community is very good, Jeremy, and that's you're such an inspiration. I would say as well, because you're not only catering to you're catering to different professions, and it's interesting, and I just wanted to congratulate you with that. I think that's an achievement on itself. And yeah, so firstly, I just wanted to thank, of course, my family in New Zealand, my mom, my dad, my brother, my sister, and their families as well. Of course, my wife, my kids, and my mother-in-law here, and all the relatives I have around the world. If you're watching at the moment, thank you for tuning in, and I'm hoping that I'm making you all proud. Thank you as well for all the viewers. I might not know some of you, but I just hope that you learned something, and I managed to even a little bit inspire you to achieve your goals and your dreams whilst in the UK. And lastly, as Jeremy has already mentioned, please, for all the nurses out there who's watching at the moment, please join our association called the Filipino Nurses Association United Kingdom. It's free membership. You don't have to pay anything, and you're gonna uh, uh, you can get a lot out. I mean, you can get a lot out of the association. We can provide you as well with different support. Might it be interview skills or leadership trainings, OSCE trainings for those who haven't done their OSCE yet. We can provide you, and we can help you with that. Okay, so if you can just Google Filipino Nurses Association, and then it's very straightforward. Just register. Okay, so again, thank you to all my colleagues in FNA UK. I'm so proud to all of you guys, our founding director who is here at the moment, Sir Francis, and all the other officers who are here as well. Thank you for all your support. And let's continue to make a difference in everybody's life, but particularly in our kababayans' lives. And let's raise the flag of the Filipino nurses. And again, thank you, Jeremy, and good evening, everyone.
Wow, thank you very much. And that's for you, bro. Wine. A glass of
Oh,
wine. Cheers.
thank you. I can have that later.
Yes, you can. And let's read a comment here from Michelle. Ayan. I love you and so blessed to have you. And thank you, Jeremy, for asking that question. There you go. Thank you, Michelle. Hayaan mo, anak. Bibigyan ko kayong dalawa ni Michelle na mag-solo. Ako na bahala sa mga bata. Yay! Ayan, thank you. Ayan, I would like to give this to Michelle and Mommy Miriam. Ayan, flowers for you. And especially anniversary nyo ni Michelle and Mark. Ayan. Thank you for joining us all. And pasalamatan natin yung mga nag-join sa atin. Si Elizabeth Clover Eugenio, Nenita, Gata, Marvic Villanueva, Lavida Greta, Arnold Pedregal, Miriam Insyong de Vera, Lady Mercury Inciso, Daisy Esguera. We have Alejandro Cruz, Francis Michael Fernando, Felix Geraldine Niebra, Cathy Rowe, Carlo Ismael Agraviador Panotes, Joffrey Corazon, Charito Rivera, Rosanita Storp Gargita, and let's just see. We have Rodel Saicon. Thank you. We have Emilia Dalauidao. Thank you for joining us. We have Arlene Bautista. Yeah, thank you. We have Sigs Baltz. Thank you. Who else? We have Manuel Sixto Agraviador Dalauidao. Yeah, thank you. Ang daddy po ni Mark. And then, of course, we have Mami Miriam Insyong de Vera. Thank you. We have Mimi Mili. Thank you very much. Ayan, thank you. Our inner works. And we have Marvic Villanueva. Thank you. We have Matthew McDonald. Evangeline Martinez. Thank you. We have Rosanita. Ayan. Stork Gargita. We have Mini Pascual Clepas. Yan. Thank you for joining us. And Joe Feli Corazon. Thank you. And who else? Christine Kit. Ayan, Dalauidao Gulan. Thank you. And syempre, ang brother from New Zealand, Dalauidao Brian Simon or Simon. Ayan. And ayan, I love you so much, anak. Sana magkita na tayo. Ayan. Ayan, and me at Mami Miriam, thank you, Jeremy. God bless you and your family. Thank you very much. All right, so this is what we've got time for. Ladies and gentlemen, again, let's give it up for Michael Mark Dalauidao, who is a modern matron in infection control and prevention and control, also the regional director of FNA UK in London, and also our Key Worker of the Year awardee in our One Nation Awards UK Breakthrough 2021. Thank you very much, Mark.
Thank
you.
you. Thank you
very much. And hope to see you soon as well. Thank you. Thank you very much. Bye for now. Bye.
Salamat. Bye-bye.
Bye. Thank you. There you go. So that's our guest for today, Michael Mark Dalauidao. Maraming salamat po sa inyong lahat, for everybody who joined us today. And what's next in JhermiNATION? This coming Sunday is a special episode, actually. So here you go. And don't forget, calling all nurses and caterers here in South London. We are expanding, so please get in touch with me. And July right. And as for me, always remember the quality of our thoughts, of our life will depend on the quality of our thoughts that we are thinking. Always make sure that you plant those seeds of positivity in your mind every single day and let it germinate so that one day you will see the better version of yourself. And I would like to give special thanks to Filipino Nurses Association UK, FNA UK. Thank you very much for all your support. And please do check out the website. And for all those who are nurses here in the UK wide, please check it out. There's a lot of seminars, workshops, OSCEs, everything, leadership, even financial education as well. Please do check out Filipino Nurses Association UK website and do join. We're encouraging everyone to join. Nurses, here in the UK. All right, so thank you very much, everyone, and see you all again. And always stay safe. Bye for now. This is Jeremy of JhermiNATION.
Hello everyone! As we are growing our community, we would like you to be part of JhermiNATION. So if you like our episode for today, please don't forget to subscribe on our YouTube channel and to like and follow our Facebook page, JhermiNATION, and to share the videos to all those people who you think will benefit from it. And if you know anybody whose life story is inspiring or even your life story can be inspiring, please get in touch with us because you'll never know. You will be our next special guest for our next episode because we believe that your life story is worth live streaming. And don't forget to watch our live stream shows every Wednesdays, 7:30 in the evening, and on Sundays, 11 o'clock in the morning, and that's UK time. See you next time. This is Jeremy of JhermiNATION.